Keeping your top players on the pitch, the key to football medicine at the professional level. Absolutely, but you can almost just sub out that to defence. So how do we keep our people available to do their duties? But also I think there's a dual role of defence. One is we need you to be healthy to undertake what you do. It's an arduous task, it's mentally and physically challenging. We need you to be able to withstand that. But also in my role, we also have to look around your total health and wellbeing across your life. And so how do we actually protect your lifetime health and wellbeing in the process of undertaking those arduous tasks? So switching gears now, coming back into defence. So I worked for 10 years at the Australian Institute of Sport, and through the AIS and Army MOU, I sort of got familiar with the Defence Force. I was a combat engineer when I was younger as a reserve. And so I thought this was a bit of a closing the loop coming back into defence, using the craft that I've done in high performance sport and bringing it back to defence. So in my role, we work to the ADF Health Strategy. But generally speaking, there's 6 focus areas and 7 enablers, and I look after one of those 7. This one's really akin to human performance. So the question here is in force optimisation. So when we're optimising the force, we want that resilient and optimised force. As for the lieutenants in the room, as commanders, you want the people that you're charged to work with to be healthy. And if you're in the ranks of private to corporal, you are those healthy, optimised force people that are going out and doing those tasks. But to get health, as I've articulated already, it's built upon a broad base of physical and mental health. It is the foundation in which all that other stuff starts to work. So here's the health research framework. Broadly, you don't need to know what's in all the boxes, but just for awareness, we want to get after some priority areas. So here's the priority themes. Musculoskeletal injuries. Army in particular is known to have injuries. What are we doing about it? How do we get after that issue to make sure that you're both healthy in the short term, but definitely over the long term too? We don't want you broken at the end of your service. We want you in a really good state. Mental health, well, clearly we're under a Royal Commission at the moment, but also it's the right thing to do. You have an arduous task and we need to look after you. And the one at the end, which I'm going to focus on, is the health of the future warfighter. That's the really cool one. That's our think big. What are you going to be doing in warfighting in the future? Let us know. We want to start to get ahead of that problem. Mental health and wellbeing is one of those priority areas of the 8 that I mentioned. There's a really great project that's due for completion. Well, it actually is completed. The report's coming out later this year. I'm going to say December. But before Christmas, let's agree on that. It was an interesting take on, we know members may not declare that they need some help early on. And so it was a 4 sort of pronged study where we asked families, command, members themselves, and health professionals around what are the factors involved with allowing people to go and get help where they want. And the Surgeon General has said any door is the right door. If you need help, go and find it. And but this was really about understanding what can we do in joint health to enable earlier intervention. So we know little problems take little intervention. You leave them, they become bigger, and they take longer times to get over. So it's really around that earliest possible intervention at the moment. And there's a few projects. The Watch is the main one. And so we will be getting those results out soon. In wrapping up, if an ounce of prevention is worth a pound of cure, the thing I really want you to walk away with is, well, then they're probably worth a stone of performance and a ton of capability.